Great. Welcome and good morning, everyone. We're here today to talk about the epidemic of the underserved, the South's maternal mortality crisis. I'm Pam Shipley, and I'm the Chief Operating Officer at ShareCare, and I'm happy here to be with my guests. I'd like to have them introduce themselves. Dr. I, we'll start with you.
All right, good morning. I'm Dr. Barry Igwabadier, a board-certified OBGYN, and I am affiliated with Care Connect OBGYN in Cordelia, Georgia, and I'm glad to be on the panel today. Thank you.
Dr. Manderson.
Hi, I'm Dr. Samantha Manderson. I'm affiliated with Care Connect Healthcare here in Cordelia, Georgia, and again, I'm very pleased to be here with you this morning.
Wade.
Thanks. It's great to be with you. I'm Wade Rakes. I'm the Plan President and Chief Executive Officer of Peach State Health Plan, which serves 1.4 million Georgians with high quality plans in Medicare Advantage, the health insurance marketplace, and Medicaid managed care. And I'm glad to be here. Grew up in Jonesboro, but live in Atlanta now.
So just to level set, Georgia, the state of Georgia to start with, has 159 counties. 8 of those counties, no physician. 63 counties without a pediatrician, 75 counties without an OBGYN, and 95 counties without a psychiatrist. When we double click on that and we look at the maternal mortality rates, 66 pregnancy associated deaths per 100,000 live births, 26 pregnancy related deaths per 100,000 live births, and that 26 related to a 17 national standard starts to show you where we sit in the state of Georgia. And I understand that 60% of pregnancies that are related to pregnancy deaths are preventable, with Black women 2.7 times more likely to die from a pregnancy-related death than a white woman. These are alarming statistics. I'd like to first start with the doctors, and let me just also, again, thank you for taking time to speak with us today. Clearly, your time is incredibly valuable and in short supply. It's so difficult to even process these numbers, and I have so many questions circling in my head today, but one that I really wanna hear from you is why did you choose to practice in rural Georgia, the single worst state in the country and arguably one of the worst in the world? And 2, what are you seeing with your patients here in Georgia? Just humanize these numbers for us.
Well, I'll start. Well, I did residency in Long Island, New York, which is a very fast-paced environment. And my reason for coming to Georgia was twofold. I had a young child where I wanted to kind of slow things down. And so when I interviewed here, I loved the community and I felt, okay, it'd be a nice place to raise my child, but also I saw the need. And I felt that coming here, I could make a difference. I really felt that where the need was, I could fill that gap. So I've been here for over 10 years. And I've never left since. I've been in the same hospital, the same community ever since I've come. Now, what I've seen is threefold, is that patients need more help and assistance, whether it be housing, transportation, continual communication with them through phone services, nutrition counseling. And for me, I think the main thing is for them to know that we're here and that they really need to see their OBGYN annually. So that especially our reproductive age patients, so that when they do desire to conceive, that preconception counseling is very, very vital. And so if we have that counseling prior to conception, I really feel that it will identify a lot of comorbidities, things that we can try and fix or be aware of before they conceive. A lot of patients don't go to the doctor. A lot of them don't have health insurance. A lot of them aren't educated on their own health. So for me, I think I love my community that I'm in. I know they need me. I see the need. I'm here to serve that need. But I still think I need a little bit more help from government agencies, health insurance agencies, to really help this community.
Dr. Manderson, I love the idea of the preconception and talking about what are their challenges up front. That's fantastic. Dr. I, how about you? Why did you choose to practice?
Mine is a little bit different story from Dr. Madison. I chose to practice in rural Georgia because of my personal life experience growing up. I actually moved from Nigeria, came to the United States when I was 16. So growing up, we had limited healthcare. So when I decided to be a physician, I wanted to give back to the underserved community. So I trained in Florida, and when I was done training, my wife actually moved to Georgia to start her pediatric residency. So that kind of forced my hand to move to Georgia and look for a area that requires or that were underserved. So I chose to practice in rural Georgia just because of my personal experience. And also working in a rural community is a privilege also. And it also afforded me the opportunity to learn and better understand what factors and impact the health and well-being of my patient have. And also working in the rural area in Cordelia has its challenges. And I've been practicing in rural Georgia for the past 8 years now. And some of the challenges that we've seen is the lack of transportation, like Dr. Madison has said, and also the ability of the patient to take paid time off due to the lack of funding for the patient, and also the poor literacy. Most of the patient has no medical knowledge of their health care at all. Also, what we've seen is low socioeconomic status, which kind of increases the morbidity and mortality for the mom as well. And also lack of financial means to pay for the services which they are applying for. And as a result of that, they do not get health care.
Wow, what a journey to get to the underserved community for you. And we're going to dig a little deeper into some of those observations. Before we do that, I was looking at some data showing that the total number of deliveries last year in 2020 in Georgia for the Medicaid population represented 56%, over 50% of the births in Georgia in that year. So Wade, I was thinking, as the CEO of Peach State Health Plan, the largest Medicaid MCO here in the state of Georgia, what's your perspective on these numbers, and what are you doing as a private organization to mitigate our maternal and infant mortality crisis we have here?
Well, thanks for that question, Pam. And we have seen in recent years that Medicaid, the joint state and federal program, is the #1 payer when it comes to maternal health all around the country. But in states that have higher levels of poverty, we see it take up numbers that are getting closer to 60% than 50%, as we're seeing here in Georgia. Peach State Health Plan has been operating for 15 years. And between our original Peach State Health Plan and WellCare of Georgia, which we acquired, we serve all 159 counties and have done so over the course of that 15-year period of time. And pregnancy and conception were things that were happening 15 years ago, and they still happen very much today. So we've focused on ensuring that we partner with the tremendous providers, tremendous physicians, and you have two amazing ones here who have that passion and connection to the community that allows for the impact that's needed to ensure the highest quality health for the mother and the child or children, should there be multiple pregnancies. So the first thing is ensuring that we are supporting the provider network throughout the state of Georgia, that we are working to be that partner, because the role as a managed care organization is to truly bridge the needs of these members to a provider network, and ultimately with levels of support that are going to allow them to have the greatest healthcare outcomes. So when it comes to maternal health, for many years, our parent company, Centene, has had a nationally recognized program, Start Smart for Your Baby, and it engages our moms early on to ensure that they're aware of what are the things that are going to lead to a healthy delivery. And there are a host of activities, but really it's about lifting that mom and co-parent up during this process, giving them the most information possible, because we know every parent wants that healthy delivery. But there are the barriers that the physicians here have talked about. So as a managed care organization, we have to bring in all the other healthcare needs that the individual may have. So of course we need anyone, as Dr. Manderson said, who is in that period of conception or in that group to see an OBGYN annually. But we also need them to see other physicians as needed. The OBGYN certainly during the pregnancy is going to be the quarterback, but we have to ensure that they have access to pharmacies. We have to ensure that they have dental care. We have to ensure that they have a whole host of other health needs so that they don't complicate the pregnancy, which is going to be the foremost matter they're dealing with during that period of time. So our role at Peach State with a team, we have nearly 1,000 individuals, is to have care management workers, nurses, and social workers engage as that bridge between the member and the provider and ensure that both have everything they need to ensure the best possible outcome for that child. And generally, if mom is eligible for Medicaid, the child will be our member once they're born and provide that link into pediatric care and again, postpartum care for both of them. So we want to be with them throughout the process, but I can, I'll stop here. But one of those is also investing in the pipeline of physicians that Georgia desperately needs.
That's great. It's really great to hear your perspective as a private organization too on the holistic health for mom. And so to think about all of the programs you mentioned with all of the additional support from the physicians. So maternal health, starts long before the water breaks and the baby cries. In fact, many of these challenges and problems, as Wade, as you mentioned, even with just looking at dental health, often already exist prior to pregnancy. So how much of an impact does individual well-being in Georgia have on our maternal mortality crisis? And should we be doing more to treat the whole woman before she becomes a statistic? Let's start with you, Dr. Manderson.
Absolutely. Like I said in prior, is that annual exam is our most important visit with a patient, especially reproductive age women, because we can identify things, including mental health. Everyone forgets about mental health. That's very important. Abuse, just barriers that they face in their day-to-day lives. So yes, treating the overall woman is vital, very vital, before they conceive. So because once they conceive, then we're faced with hypertension, obesity, malnutrition, drug abuse, all of that. But if we can deal with those issues prior, then we can move towards having a more healthy, positive birth experience and positive outcomes in this population that we have. So again, if you ask me about treating the whole woman, I am totally on board. And as Wade had said, things like dentition, going to the dentist, just simple things like that. A lot of times they don't have health insurance, and so they don't get health care. They only go to the convenient care when they're sick or put a Band-Aid on things. But what I found as well is a lot of women who are working can't afford health insurance. It's very expensive, the plans and options that they have. But what I've been finding is that with Peach State, a lot of them have been opting for a Peach State plan because they have the more affordable one. And I'm not just saying that because I'm on this panel, it's the truth, it's what I've been seeing. So thank you to Peach State for giving those options to them, because they'll say, Dr. Manderson, I've had these options, this is what it costs, this is what I can afford, so this is why I chose Ambetter or one of the plans. So again, thank you to Peach State for giving them those options, because if not, they would go without health care. And again, we would go without seeing them and catching these things like, again, hypertension, obesity, mental health issues, social issues that we wouldn't normally see. And once they come in and they're pregnant, the horse has left the stable, we have to kind of backtrack now and fix and things that they need. So yes, again, to answer your question, the overall well-being of the woman is very important, and that annual exam is vital.
Dr. I, in your experience, do you have anything to add to how we look at treating the whole woman?
Yeah, just a few things to add. The overall health of individuals significantly impact the mortality rate in Georgia. Our goal as a physician is to optimize any medical condition that would increase the mortality rate prior to pregnancy. And we want to capture this patient prior to being pregnant. And by doing that, like Dr. Madison says, is the pre-conceptual counseling. In that visit, you go over the medical conditions that the patient may have, like such as high blood pressure, diabetes, that we already know that increase the mortality rate during pregnancy. So by optimizing those conditions, you have a better outcome, and the mom has a better outcome, and the baby, they do well. We also address social issues that could impact, the mortality rate that the patient may have, and also I think most of the patient that we have in a rural area, they only see their OBGYN as their primary care. That's the only doctor they go to. So if you ask who's your doctor, they'll tell you either Dr. Mandisi or Dr. I. I see Dr. I for my blood pressure. I see Dr. I for my diabetes, my heart condition, but Dr. I can't take care of every medical condition. So the lack of primary care physicians in the community can also impact the mortality rate. So if we can capture those patients prior to pregnancy, at least a year prior to pregnancy, optimize their medical condition, we have a better outcome.
Yeah. Well, and just looking at some of those statistics, 8 counties without a single physician, even in the county. It's alarming. So in addition to access, you've all mentioned a number of barriers that compound these problems for our Georgians. And broadband ubiquity, tech availability has always been part of the discussion for years. You mentioned mental health, basic nutrition, housing, transportation, just to name a few. Our communities, both rural and non-rural, are suffering due in a large part to the social determinants of health. So doctors, is there one of these factors you see having more of a negative impact, or is maternal health and the real challenge that we have today simply the collective impact?
From my perspective, I think is a collective impact. You can see due to the COVID pandemic, we have seen acceleration of the growth of telehealth medicine service. But unfortunately, there are some areas in the community that lack access to a broadband internet, and also experience a slower internet speed, which is a barrier to telemedicine. And majority of our patients cannot afford the broadband access. As a result, we cannot provide telemedicine to this patient population.
Dr. Manderson, anything to add there? Are you thinking of, is there anything one particular aspect, or is it really the collective of all of these that are there?
Again, when Dr. I had said, it really is a collective. It really is. It's just all compounding situation here in the South. And you can address each one individually, with transportation, broadband, nutrition, access to healthcare. And I just feel that if we have agencies dedicated to each area, because one person can't fix everything, but we really need to, as a collective, look at each aspect and see what can be done to improve each aspect: nutrition, transportation, health insurance, broadband issues. But yes, it definitely is a collective that has to be addressed and handled individually to see any kind of improvement.
So Wade, when you think about all of these different challenges, what, as a private organization, what policies or programs in Georgia do you see that are really making the greatest impact, or have the potential to make the greatest impact on these social determinants of health and health inequities?
Well, Pam, I think when we hear this, it can just be sobering, almost to the degree that you'd never know where to start. And it seems like you're pushing the boulder up the highest hill possible. But I will say Georgia is making progress. It may not be as swift as we would want it to be, but Georgia has dedicated individuals, physicians, organizations like ours, faith-based and community organizations that are working very hard to increase the knowledge for members and individuals so that they can make more informed choices. So when we look at the tech enablement that exists today, and the ability for organizations like yours in the pocket of an individual, give them more health information than I can remember acquiring in college, is on that phone. So we do see that there's more. but you have to make it, and you mentioned this earlier, you have to humanize it. So the reason that we have hundreds of employees at Peach State Health Plan is to ensure that we can have a touch on those members in greatest need, to provide them support, to provide them encouragement. But I could go through a whole list of community organizations that we partner with around the state of Georgia that are focused on the health of their community at large. And certainly when it comes to maternal health and kids, there's so many great organizations that are doing work. What we've done at Peach State is really focus on that pipeline of future physicians to ensure that we're very fortunate to have attracted these two physicians to the state of Georgia, but Georgia's a growing state. Yeah, when we look at other states in the country, their population is flat, some are declining, but Georgia has had growth. Certainly, I grew up here since the Olympics. I think any of us can remember pre-Olympics and post-Olympics, and just the massive infusion of great new talent in Georgia. But that's meant that we've had to invest in the Medical College of Georgia and Morehouse School of Medicine, which Peach State, we're fortunate to have tremendous partnerships with to help them attract students. And if those students stay here in the state of Georgia, their costs are defrayed. And I'm sure the two physicians here could tell you the cost of a medical education is very, very high. And if we can ensure that those folks who already come to Georgia for education just stay, and preferably stay in a community that has great needs. But when it comes to maternal health, we have needs everywhere. We have needs in zip codes in Metro Atlanta, and we have needs throughout rural Georgia. So for us as a partner organization, that's one of our primary focuses. We're going to take care of the folks now, but we have to invest in that pipeline for the future, because Georgia is a growth state, and Georgia is leading the nation in so many areas of healthcare innovation. So we have to ensure that we have the people to be sitting in our seats talking about this 10 years from now, 20 years from now, hopefully 30 years from now, I might be retired. So.
That's great, Wade. We appreciate hearing about the programs that are already in place, and then the things that you're looking to either continue or even launch. And one of those programs, as you mentioned, is with our company, ShareCare. And so we were super excited to launch that just here a few months ago in the childbearing age years, and really looking forward to that partnership of two private organizations based right here in the state of Georgia, and working with physicians like Dr. Manderson and Dr. I to just full circle surround the woman in health and everyday well-being. So thank you for that. So here we are sitting on Zoom and not in person due to COVID and the pandemic. So I would be, really at a loss here if I didn't mention COVID, and just ask, how has COVID impacted maternal health in Georgia? And then, what I really was thinking about is there a learning from the pandemic that we can apply to the maternal mortality crisis? I mean, Dr. You mentioned some things around telehealth, and so there's other things that have really accelerated or changed during the pandemic. Is there a learning that we can apply and help with the maternal and infant mortality crisis here?
Well, we know that COVID has played a significant impact on maternal health in Georgia. Pregnant women have a higher risk for more severe disease from COVID than a non-pregnant patient. And we also know that a pregnant woman who has COVID and shows more symptoms is more likely to be admitted to the ICU, needing ventilators, and more likely to die from COVID-related illness. And the overall risk of this severe illness and death from pregnancy is actually low. In our community, we haven't had any maternal death from COVID, but in other areas, it might be a different case. When we see women with some health conditions such as morbid obesity and gestational diabetes, chronic hypertension, the risk of getting severe illness from COVID is actually higher. So the lesson that we can learn from the pandemic is the vaccine, which the vaccine has played a significant role in decreasing the morbidity and mortality in maternal health. and as a matter of fact, in all areas of life. And according to our College of Medicine, the American College of Obstetrics and Gynecologists, they recommend that every pregnant patient be vaccinated for COVID. And we've seen that at least people who are vaccinated, is the prevention from severe illness is actually less, and the death from COVID-related illness is actually less. So, lesson to take home from this is vaccine do save lives.
Dr. Manders, anything that you think we can learn?
Yes, well, I agree. It's very important for patients to be vaccinated, but of course we have that barrier of those who aren't even or who are not pregnant do not want to get vaccinated. It's very hard to counsel a pregnant patient who normally, if they weren't pregnant, wouldn't be vaccinated. Now that they're pregnant, they still don't want to be vaccinated. And so all you can do is counsel, but vaccines do save lives. And as far as COVID overall, it really hadn't slowed down our OB population because we cannot do telemedicine with an OB patient. Those are hands-on visits. So they still came to their visits. So that hasn't slowed that aspect down. But as far as the vaccination protocol and recommendations, yes, we really would love for our pregnant patients to be vaccinated, but unfortunately, whether pregnant or not, their decisions have seemed to be more not wanting to be vaccinated than vaccinated. But we're working on it. And we'll continue to work on it and counsel every chance that we get.
That's great. Thank you.
Yes.
So where do we go from here? So today we have a group of passionate practitioners, educators, innovators, healthcare policymakers listening. What do you want them to take from this discussion, and what do you and your patients need from them? Dr. Manderson, let's start with you.
For me, the one thing would be access to healthcare. That's the starting point of everything. For that reproductive age female to go to their GYN annually. If I could just say that over and over again, please just come to me annually. We can figure everything out from there. So for me, access to healthcare.
Dr. I?
My take-home message is how can we reduce the maternal mortality in rural Georgia? And one, we need to figure out a solution to I know Wade spoke about it, the shortage of physicians in the rural area. What are some of the incentives that we can, apply to attract physicians to this rural area to provide access to healthcare? And also, we need adequate access to healthcare. If you see in the last 10 years, most of the rural communities, the hospitals are closing every day by the numbers. And those patients have to travel from outside of their county to a different county to receive healthcare. And as a result of that, most of them will not go to any of the appointment because the distance between your home to the access to healthcare is tremendous, and they create a burden for the patient population. And also, we need to strategize some protocols to limit those barriers that can limit access to healthcare.
Wade, closing thoughts?
So these are building on these two, and I'd like to take a minute to talk about what the pandemic has informed. And the pandemic has also informed the crisis of social isolation. That we have individuals who normally would be going to baby showers and engaging in ways that are affirming during their pregnancy because their safety is so important. They're at home, and they may be home alone, or they may be home with very few visitors, like all of us right now who take this pandemic as seriously as it has, with so many lives of our neighbors taken. So we are looking and seeing that issue of social isolation and the mental health impact that it has, mental and behavioral health impact that it has, is critical to keep our eye on. And I would want to ensure that we're all understanding the impact from a social emotional health standpoint that the situation we're in with the pandemic has had on our moms and can have on their babies. So the good news is that we see our legislators and the governor increase funding for postpartum care. And we see the federal government increasing funding for postpartum care because that social and emotional component is so critically important. But we need to ensure that the conversations that we're having today continue to be heard by policymakers so that resources can be directed to provide the very best outcomes for moms and for kids here in our state. So I would say thank you to anyone who's listened to the panel. I think we've given a lot of areas of impact for individuals to contribute to the brighter future of Georgia for these babies and for their parents. So investing in this pipeline to ensure we have the physicians and their staffs. So it's physicians, it's nurses, it's social workers, it's reception people, it's the administrative function, it's the health and safety. I think all of us know the folks doing health and safety work and cleaning and ensuring have been more important than ever. We need to ensure we have the workforce. We need to ensure that we continue to have the focus on technology and technological innovation in the state. And we need to ensure that we continue to keep the mom at the center of it all and support her in every way possible. So I get excited about the future, and I think the folks participating in the conference today can help us tremendously.
So on that note, let me thank Health Connect South for allowing us to hit a very hard to discuss topic. And I know that the listeners out there will really continue to further the programs and policies and efforts that we need to really turn this around so that Georgia is not the last state in the country around maternal mortality and infant mortality as well. So thank you, doctors, and thank you, Wade, for your insightful discussion. And really thank you so much for all the work you're doing in an effort to improve our maternal health here in the state of Georgia. Thank you for joining me this morning.
Thank you for having me. I appreciate it.
Thank you.
Thank you.